Phlebotomy exam tips and tricks. Question 1. What is the maximum depth that a lancet should penetrate when performing a heel stick puncture on a newborn infant? Option F 1.0 mm, Option B 2.0 mm, Option C 3.0 mm, Option D 4.0 mm. The correct answer is option B, 2.0 mm. A newborn heel lancet should not penetrate deeper than 2.0 mm. This limit reduces the risk of striking bone and causing osteomyelitis. Deeper punctures are unsafe even if blood flow is difficult. Question 2. What is the primary clinical reason for wiping away the first drop of blood during a capillary skin puncture? Option A. To eliminate surface bacterial contamination from the skin. Option B. To remove tissue fluid contamination that can dilute the sample and cause microclots. Option C. To prevent the blood from clotting too quickly in the microcollection tube. Option D. To ensure that the blood flow is adequate for collection. The correct answer is option B. To remove tissue fluid contamination that can dilute the sample and cause microclots. The first drop from a capillary puncture is wiped away because it can contain tissue fluid and activated clotting material. Removing it improves sample concentration and reduces microclot risk. Excessive squeezing after the puncture can reintroduce tissue fluid contamination. Question 3. According to the Clinical and Laboratory Standards Institute, CLSI, which tube must be collected first in the standard order of draw? Option of light blue top. Option B, lavender top. Option C, blood culture vials. Option D, green top. The correct answer is option C, blood culture vials. Blood culture bottles are collected before other tubes to protect sterility and prevent additive contamination from later tubes. This order is especially important because even minor contamination can affect organism recovery and antibiotic decisions. Coagulation, hematology, and chemistry tubes follow later because their additives can interfere if carried into cultures. Question 4. What type of fluid is obtained during a lumbar puncture procedure? Option A, pleural fluid. Option B, synovial fluid. Option C, cerebrospinal fluid, CSF. Option D, peritoneal fluid. The correct answer is option C, cerebrospinal fluid, CSF. A lumbar puncture obtains cerebrospinal fluid from the subarachnoid space. CSF surrounds the brain and spinal cord and is tested for infection, bleeding, malignancy, and other neurologic conditions. Pleural, synovial, and peritoneal fluids come from different body cavities. Question 5. What constitutes a proper unique identifier sequence for an inpatient according to the Joint Commission? Option A, full name and room number. Option B, full name and date of birth. Option C, attending physician and bed number. Option D, date of birth and diagnosis. The correct answer is option B, full name and date of birth. Two reliable identifiers are required to link the specimen to the intended patient. Full name and date of birth are acceptable because they identify the person rather than the location. Room number, bed number, diagnosis, or physician name can change and should not be used as primary identifiers. Question 6. What is the minimum amount of time a serum separator tube, SSD, must stand in a vertical rack to clot completely before centrifugation? Option A, 5 minutes. Option B, 10 minutes. Option C, 30 minutes. Option D, 90 minutes. The correct answer is option C, 30 minutes. Serum separator tubes usually need about 30 minutes upright to clot fully before centrifugation. Spinning before clot completion can produce fibrin strands and interfere with serum separation. Waiting too little risks poor specimen quality, while excessive delay may affect some analytes. Question 7. Which of the following veins is located on the outer thumb side of the arm and is the third choice for venipuncture? Option A, cephalic vein. Option B, basilic vein. Option C, median cubital vein. Option D, brachial vein. The correct answer is option A, cephalic vein. The cephalic vein lies on the lateral, thumb side of the arm and is often a later choice for venipuncture. It may be more difficult to anchor and access than the median cubital vein. The basilic vein is medial and carries greater nerve and artery risk. Question 8. Hemoconcentration can be caused by which of the following actions? Option A. Leaving the tourniquet on for longer than 1 minute. Option B. Using a needle that is too small for the vein. Option C. Inverting the collection tubes too slowly. Option D. Puncturing the skin before the alcohol is dry. The correct answer is option A. Leaving the tourniquet on for longer than 1 minute. Prolonged tourniquet application traps blood in the limb and allows fluid to shift out of the vessels. This concentrates cells and analytes, producing hemoconcentration and potentially misleading results. Needle size, tube inversion speed, and wet alcohol cause different specimen problems such as hemolysis or contamination. Question 9. Which of the following tests requires that the specimen be transported to the laboratory on an ice slurry immediately after collection? Option A. Lactic acid and ammonia. Option B. Cold agglutinins and cryoglobulins. Option C. Bilirubin and vitamin B6. Option D. Prothrombin. Patient. The correct answer is option A. Lactic acid and ammonia. Lactic acid and ammonia specimens are commonly transported on an ice slurry to slow cellular metabolism and chemical change. Rapid chilling helps preserve the concentration present at collection. Warm transport or light protection is required for different special tests. Question 10. What color top tube contains sodium heparin or lithium heparin and is the primary choice for stat chemistry determinations? Option A. Green top. Option B. Light blue top. Option C. Lavender top. Option D. Yellow top. The correct answer is option A. Green top. Green top tubes contain sodium or lithium heparin and are commonly used for stat chemistry testing. Heparin allows plasma to be separated quickly without waiting for clot formation. Serum tubes require clotting time and are not always ideal for urgent chemistry turnaround. Question 11. Which vein is considered the first choice for venipuncture in the antecubital fossa? Option A. Basilic vein. Option B. Cephalic vein. Option C. Median cubital vein. Option D. Brachial vein. The correct answer is option C. Median cubital vein. The median cubital vein is usually preferred because it is large, well anchored, and less likely to roll. It also lies farther from major nerves and arteries than the basilic vein. The cephalic vein can be used when necessary, but it is often less stable and more difficult to access. Question 12. When collecting a blood alcohol level for legal purposes, what antiseptic should be used to cleanse the site? Option A. 70% isopropyl alcohol. Option B. Tincture of iodine. Option C. Chlorhexidine gluconate or soap and water. Option D. Hydrogen peroxide. The correct answer is option C. Chlorhexidine gluconate or soap and water. Alcohol-based skin cleansers are avoided for legal blood alcohol collections because they can raise questions about contamination. Chlorhexidine, povidone iodine, or soap and water are acceptable non-alcohol alternatives depending on policy. Routine alcohol prep pads are appropriate for many venipunctures but not for forensic alcohol testing. Question 13. What is the standard duration for an administrative scrub or hand washing when preparing for routine patient contact? Option A. 5 seconds. Option B. 20 seconds. Option C. 1 minute. Option D. 3 minutes. The correct answer is option B. 20 seconds. Routine hand washing before patient contact should last at least 20 seconds. This duration allows adequate friction and contact time to remove transient microorganisms. Very brief washing is ineffective, while surgical scrub times are reserved for different procedures. Question 14. Which of the following tests evaluated the intrinsic pathway of the coagulation cascade and is used to monitor heparin therapy? Option A. Prothrombin time. Patient. Option B. Activated partial thromboplastin time, APTT. Option C. Bleeding time test. Option D. Fibrin degradation products, FDP. The correct answer is option B. Activated partial thromboplastin time, APTT. APTT evaluates the intrinsic and common coagulation pathways and is used to monitor unfractionated heparin therapy. Heparin prolongs clotting activity measured by this test. Patient and INR are more associated with warfarin and the extrinsic pathway. Question 15. What type of specimen is used for a guaiac smear test? Option A, sputum. Option B, urine. Option C, feces. Option D, cerebrospinal fluid. The correct answer is option C, feces. A guaiac smear tests feces for occult blood. It is used to screen for hidden gastrointestinal bleeding that may not be visible. Sputum, urine, and cerebrospinal fluid are collected for different diagnostic purposes. Question 16. Which of the following additives is found in a grey top tube and works by precipitating calcium to prevent clotting? Option A, potassium oxalate. Option B, sodium citrate. Option C, lithium heparin. Option D, DDTA. The correct answer is option A, potassium oxalate. Potassium oxalate prevents clotting by precipitating calcium, making calcium unavailable for the coagulation cascade. It is commonly paired with sodium fluoride in grey tubes. Citrate and EDTA bind calcium differently, while heparin works through antithrombin. Question 17. Which of the following additives is used in a blood culture bottle to neutralize antibiotics circulating in the patient's blood? Option A, resin or activated charcoal particles. Option B, sodium polyent whole sulfonate, SPS. Option C, acid citrate dextrose, ACD. Option D, thixotropic gel barrier. The correct answer is option A, resin or activated charcoal particles. Resin or activated charcoal in blood culture bottles can bind or neutralize antibiotics present in the patient's blood. This improves recovery of organisms when the patient has already received antimicrobial therapy. The additive does not replace sterile collection technique or proper bottle filling. Question 18. What is the main clinical outcome of inadvertent arterial puncture during a venipuncture attempt? Option A, rapid hematoma formation and bright red pulsing blood. Option B, falsely decreased systemic blood pressure. Option C, accelerated hemolysis within the vacuum collection tube. Option D, immediate collapse of the surrounding capillary beds. The correct answer is option A, rapid hematoma formation and bright red pulsing blood. Accidental arterial puncture often produces bright red, pulsating blood and can cause rapid hematoma formation. The needle should be removed and firm pressure applied because arterial pressure is higher than venous pressure. Treating it like a routine venous draw increases bleeding risk. Question 19. Which additive is present in a light blue top tube used for coagulation testing? Option A, sodium heparin. Option B, ethylenediamine tetracetic acid, EDTA. Option C, sodium citrate. Option D, potassium oxalate. The correct answer is option C, sodium citrate. Sodium citrate prevents clotting by binding calcium while preserving coagulation factors for testing. The tube must be filled properly because the citrate-to-blood ratio directly affects clotting test accuracy. EDTA, heparin, and oxalate tubes use different anticoagulant mechanisms and are not substitutes for routine coagulation studies. Question 20. What type of safety equipment should be accessed if a hazardous chemical splashes directly onto a phlebotomist's arms and torso? Option A standard eye wash station. Option B, a safety drench shower. Option C, a fire blanket wrap. Option D, an isolation gown station. The correct answer is option B, a safety drench shower. A safety drench shower is used when hazardous chemicals splash over large body areas such as the arms and torso. Immediate flushing helps dilute and remove the chemical to reduce tissue damage. An eye wash station is designed for eye exposure rather than full body contamination. Question 21. What is the modern medical term for a condition characterized by an abnormally low white blood cell count? Option A, leukocytosis. Option B, leukopenיה. Option C, thrombocytopenia. Option D, polycythemia. The correct answer is option B, leukopenיה. Leukopenia means an abnormally low white blood cell count. It may indicate marrow suppression, infection effects, medication effects, or immune compromise depending on context. Leukocytosis is high white blood cells, while thrombocytopenia and polycythemia refer to platelets and red cell mass. Question 22. What is the primary purpose of applying a tourniquet during a venipuncture procedure? Option A. To stop the arterial blood flow to the limb. Option B. To engorge the veins and make them more palpable. Option C. To anchor the vein and prevent it from rolling. Option D. To ensure the sterility of the puncture site. The correct answer is option B. To engorge the veins and make them more palpable. A tourniquet temporarily slows venous returns so veins become fuller, easier to see, and easier to palpate. It should not stop arterial flow or be tightened enough to injure the patient. Vein anchoring and skin antisepsis are separate steps with different purposes. Question 23. What should a phlebotomist do if they encounter a patient who does not speak the same language as the healthcare provider? Option A. Use hand gestures to explain the invasive procedure and proceed with the draw. Option B. Enlist the services of a certified medical interpreter to ensure proper communication and consent. Option C. Ask the patient's roommate to translate the instructions for you. Option D. Cancel the test order and document the patient as uncooperative. The correct answer is option B. Enlist the services of a certified medical interpreter to ensure proper communication and consent. Certified medical interpreters ensure that the patient receives accurate information and can provide meaningful consent. Family members or untrained staff may omit, alter, or misunderstand medical details. Clear communication is essential for safety, cooperation, and legal compliance. Question 24. What does the term leukämia describe? Option A. A high concentration of broken red blood cells giving serum a red tint. Option B. A milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Option C. A dark yellow or amber tint in serum caused by elevated bilirubin levels. Option D. A clear, watery fluid component lacking any cellular proteins. The correct answer is option B. A milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Leukämia describes a cloudy or milky serum or plasma appearance caused by high lipid content. It commonly follows recent fatty meals or certain metabolic conditions. Hemolysis appears red or pink, while icterus appears yellow to amber. Question 25. If a phlebotomist encounters an outpatient who is hyperventilating and trembling with severe anxiety before a draw, what should they do? Option A. Proceed immediately to get the draw over with quickly. Option B. Instruct the patient to take slow, deep breaths and offer reassurance. Option C. Reschedule the test for a different week. Option D. Administer a sedative if available in the room. The correct answer is option B. Instruct the patient to take slow, deep breaths and offer reassurance. Severe anxiety and hyperventilation should be addressed before attempting venipuncture. Calm reassurance and slow breathing can reduce the risk of syncope, movement, or panic during the draw. Proceeding quickly or administering medication is not appropriate for a phlebotomist. Question 26. What type of transmission occurs when an infectious agent is spread through contaminated food, water, or drugs? Option A. Vehicle-borne transmission. Option B. Vector-borne transmission. Option C. Airborne transmission. Option D. Direct contact transmission. The correct answer is option A. Vehicle-borne transmission. Vehicle-borne transmission occurs through contaminated food, water, drugs, or other shared substances. The infectious agent is carried by a non-living medium to the host. Vector-borne transmission involves living carriers such as mosquitoes or ticks. Question 27. Which additive acts as a glycolytic inhibitor in a gray top tube? Option A. Sodium fluoride. Option B. Lithium heparin. Option C. DDTA. Option D. Thrombin. The correct answer is option A. Sodium fluoride. Sodium fluoride inhibits glycolysis, slowing the breakdown of glucose by blood cells after collection. It is commonly paired with an anticoagulant in gray tubes for glucose-related testing. Heparin, EDTA, and thrombin serve different purposes and do not primarily preserve glucose. Question 28. Which of the following conditions is an example of an autoimmune or hematological test commonly drawn in a lavender tube? Option A. Prothrombin time, patient. Option B. Erythrocyte sedimentation rate, ESR. Option C, basic metabolic panel, BMP. Option D, blood culture series. The correct answer is option B, erythrocyte sedimentation rate, ESR. ESR is commonly collected in an EDTA tube because the test evaluates red cell settling in anticoagulated blood. Lavender tubes preserve cellular components and prevent clotting. Coagulation and chemistry tests require different tubes and additives. Question 29. Which of the following is a characteristic of arterial punctures that differentiates them from venipunctures? Option A. The blood is typically dark red or maroon. Option B. The blood will pulse spontaneously into the syringe. Option C. A tourniquet must be applied extremely tight. Option D. The angle of needle insertion is 15 degrees. The correct answer is option B. The blood will pulse spontaneously into the syringe. Arterial blood is under higher pressure and may pulse into the syringe without vacuum assistance. It is usually brighter red because it is more oxygenated. Venous blood typically flows more steadily and is collected at a shallower angle. Question 30. What is the correct action if a phlebotomist accidentally sticks themselves with a used needle? Option A. Wash the site with soap and water and immediately report the incident to a supervisor. Option B. Squeeze the wound to expel blood and apply a tight bandage. Option C. Wait until the end of the shift to fill out an incident report. Option D. Ask the patient if they have any blood-borne infectious diseases. The correct answer is option A. Wash the site with soap and water and immediately report the incident to a supervisor. A needle stick exposure should be washed promptly with soap and water and reported immediately. Rapid reporting allows exposure evaluation, source testing when permitted, and timely post-exposure management. Squeezing the wound, delaying the report, or questioning the patient informally is not an adequate response. Question 31. What is the correct protocol for an inpatient who is sleeping when the phlebotomist arrives to draw blood? Option A. Draw the blood quietly without waking them up to minimize pain. Option B. Gently wake the patient, identify them properly, and explain the procedure before proceeding. Option C. Skip the patient and mark them as unavailable on the computer. Option D. Ask the patient's roommate to confirm their identity for you. The correct answer is option B. Gently wake the patient, identify them properly, and explain the procedure before proceeding. A sleeping inpatient must be awakened and identified before collection. The phlebotomist should explain the procedure and obtain cooperation when possible. Drawing quietly without waking the patient prevents proper identification and consent. Question 32. What is the correct action if a phlebotomist cannot find a suitable vein in either of the patient's antecubital fossae? Option A. Probe blindly in the area where the median cubital vein should be located. Option B. Inspect the dorsal aspects of the patient's hands for accessible veins. Option C. Attempt a venipuncture on the inside aspect of the patient's wrist. Option D. Draw blood from a vein located on the anterior aspect of the lower leg. The correct answer is option B. Inspect the dorsal aspects of the patient's hands for accessible veins. If antecubital veins are not suitable, the dorsal hand veins are the usual next site to inspect. They require careful anchoring and often a smaller device because they are more fragile. Blind probing or using wrist and lower extremity sites increases risk and may require special approval. Question 33. Which of the following parameters is most heavily impacted if a phlebotomist squeezes or milks a finger during a capillary puncture? Option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Option B. The blood flow will stop completely due to arterial vasoconstriction. Option C. The platelet count will become falsely elevated beyond high limits. Option D. The glucose values will drop to zero within seconds. The correct answer is option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Milking a finger forces tissue fluid into the drop and can rupture cells. This dilutes the specimen and may cause hemolysis or inaccurate results. Gentle warming and proper puncture technique are preferred ways to improve blood flow. Question 34. Which of the following factors can cause a specimen to become hemolyzed during processing? Option A, allowing a serum separator tube to clot completely before centrifugation. Option B, balancing the centrifuge correctly with tubes of equal volume. Option C, centrifuging a specimen before it has completely clotted or spinning at an excessively high RPM. Option D, keeping a plasma specimen chilled on an ice slurry. The correct answer is option C, centrifuging a specimen before it has completely clotted or spinning at an excessively high RPM. Centrifuging a specimen before it clots completely or spinning too aggressively can rupture cells. This processing-related hemolysis can make serum or plasma red and alter analytes. Proper clot time and centrifuge settings help prevent specimen damage. Question 35. What is the primary reason for avoiding venipuncture on an arm with an active hematoma? Option A, the needle will cause the hematoma to spread to the opposite arm. Option B, the sample will be contaminated with hemolyzed, stagnant blood from outside the vein. Option C, the vacuum tubes will implode due to tissue density variations. Option D, it will cause immediate and permanent paralysis of the limb. The correct answer is option B, the sample will be contaminated with hemolyzed, stagnant blood from outside the vein. A hematoma contains pooled blood outside the vein that may be stagnant or hemolyzed. Drawing through or near it can contaminate the sample and worsen tissue injury. A different site, preferably the opposite arm, should be selected when possible. Question 36. What clinical complication can arise if a phlebotomist punctures the skin through wet alcohol? Option A, the needle will slip and miss the vein entirely. Option B, the red blood cells in the sample may hemolyze, ruining the specimen integrity. Option C, the patient's blood pressure will drop rapidly. Option D, the vacuum inside the collection tube will increase significantly. The correct answer is option B, the red blood cells in the sample may hemolyze, ruining the specimen integrity. Puncturing through wet alcohol can introduce alcohol into the specimen and irritate the site. It may contribute to hemolysis and can cause a stinging sensation for the patient. The antiseptic must air dry completely before needle insertion. Question 37. When performing a dermal puncture on an infant's heel, what is the maximum allowable depth to prevent osteomyelitis? Option A, 1.0 mm. Option B, 2.0 mm. Option C, 3.0 mm. Option D, 4.0 mm. The correct answer is option B, 2.0 mm. Newborn heel punctures must be shallow enough to avoid the calcaneus and deeper tissues. A maximum depth of 2.0 mm is used to reduce the risk of osteomyelitis and nerve or bone injury. Deeper lancets are unsafe for infants even if they appear to improve blood flow. Question 38. What is the major drawback of using a needle with a gauge size of 25 or higher for venipuncture? Option A, it causes severe tissue tearing upon skin entry. Option B, it carries an extremely high risk of causing hemolysis in the sample. Option C, it penetrates too deeply into the bacillic structures. Option D, vacuum tubes will lose their suction pressure entirely. The correct answer is option B, it carries an extremely high risk of causing hemolysis in the sample. Very small needles, such as 25 gauge or higher, can damage red cells as blood is forced through a narrow lumen. This increases hemolysis risk and may compromise chemistry results. Larger needles are not always appropriate, but extremely small gauges are avoided for routine venipuncture. Question 39. What should a phlebotomist do if they accidentally puncture an artery during an attempted venipuncture? Option A, complete the draw quickly and label the tube as venous blood. Option B, remove the needle immediately, apply firm, direct pressure to the site for at least 5 minutes, and notify nursing staff. Option C, leave the tourniquet tied tight to prevent a hematoma from forming. Option D, instruct the patient to bend their arm firmly over a gauze pad. The correct answer is option B, remove the needle immediately, apply firm, direct pressure to the site for at least 5 minutes, and notify nursing staff. An arterial puncture during venipuncture requires immediate needle removal and firm direct pressure for an extended period. Nursing staff or the provider should be notified because arterial bleeding can form a significant hematoma. Continuing the draw or applying light pressure is unsafe. Question 40. What is the clinical purpose of performing a bleeding time test? Option A. To evaluate the integrity of the intrinsic coagulation pathway. Option B. To assess platelet function and the capillary bed's ability to form a primary plug. Option C. To measure the absolute concentration of fibrinogen molecules in plasma. Option D. To screen the body for active systemic bacterial infections. The correct answer is option B. To assess platelet function and the capillary bed's ability to form a primary plug. Bleeding time assesses platelet function and the ability of small vessels to form a primary hemostatic plug. It reflects platelet-vessel interaction rather than the intrinsic or extrinsic coagulation pathways. Coagulation factor problems are better evaluated with tests such as patient or APTT. Question 41. Which of the following steps is part of the proper protocol for performing a newborn screening? PKU. Collection. Option A. Layering multiple drops of blood onto a single filter paper circle. Option B. Touching the filter paper directly to the infant's heel puncture site to absorb blood into the circles. Option C. Using a capillary tube to collect blood and then smearing it across the card. Option D. Wiping the filter paper card with isopropyl alcohol before applying blood. The correct answer is option B. Touching the filter paper directly to the infant's heel puncture site to absorb blood into the circles. Newborn screening cards should be filled by allowing blood to soak directly from the heel drop into the filter paper circles. The paper should not be pressed hard against the skin or layered repeatedly. Proper saturation through the paper is essential for valid screening. Question 42. What is the primary medical reason for avoiding the basilic vein for routine venipuncture procedures whenever possible? Option A. The vein is too small to yield an adequate sample volume. Option B. The vein is located in close anatomical proximity to the brachial artery and the median nerve. Option C. The vein has a high tendency to collapse under normal vacuum tube pressure. Option D. The vein lacks a sufficient path to the superior vena cava system. The correct answer is option B. The vein is located in close anatomical proximity to the brachial artery and the median nerve. The basilic vein is avoided for routine draws because it lies close to the brachial artery and median nerve. Injury in that area can cause significant bleeding or nerve symptoms. Safer veins should be selected first whenever they are available. Question 43. Which of the following factors can lead to hemoconcentration during a blood draw? Option A. Releasing the tourniquet as soon as blood flow is established. Option B. Allowing the patient to pump their fist repeatedly and forcefully. Option C. Positioning the patient's arm downward during the procedure. Option D. Using a large bore needle on a deep, patent vein. The correct answer is option B. Allowing the patient to pump their fist repeatedly and forcefully. Forceful or repeated fist pumping during tourniquet application increases local muscle activity and venous stasis. This can concentrate analytes and falsely elevate potassium or other chemistry values. The patient may make a fist, but continuous pumping should be avoided. Question 44. What type of specimen is obtained when a blood sample collected in a heparinized tube is centrifuged? Option A. Serum. Option B. Plasma. Option C. Whole blood. Option D. Fibrin clot. The correct answer is option B. Plasma. Centrifuged blood collected in a heparin tube yields plasma because clotting was prevented. Plasma contains fibrinogen and other clotting factors. Serum requires the blood to clot before centrifugation. Question 45. Which organization regulates safety conditions in the workplace, including exposure to blood-borne pathogens? Option A. CDC. Option B. FDA. Option C. OSHA. Option D. CLSI. The correct answer is option C. OSHA. OSHA sets and enforces workplace safety requirements, including rules for blood-borne pathogen exposure. These standards address training, protective equipment, sharp safety, and exposure control plans. CDC and CLSI provide guidance, but OSHA is the regulatory enforcement agency for workplace safety. Question 46. What type of consent is given when a patient extends their arm and rolls up their sleeve for a blood draw? Option A. Informed consent. Option B. Expressed consent. Option C. Implied consent. Option D, statutory consent. The correct answer is option C, implied consent. Implied consent occurs when a patient cooperates through behavior rather than signing or verbally stating agreement. Extending the arm after the procedure is explained shows permission for a routine blood draw. Written informed consent is used for procedures with greater risk or more formal requirements. Question 47. Which of the following factors can cause a false decrease in a patient's serum glucose measurement? Option A, separating the serum from the red blood cells within 30 minutes of collection. Option B, leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Option C, transporting the specimen to the laboratory on an ice slurry. Option D, utilizing a gray top tube containing sodium fluoride to collect the sample. The correct answer is option B, leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Glucose can fall falsely when an uncentrifuged specimen sits at room temperature because cells continue to metabolize glucose. This ongoing glycolysis lowers the measured concentration over time. Prompt separation or collection in a fluoride-containing tube helps prevent the decrease. Question 48. What should a phlebotomist do if they note that an inpatient's identification band is attached to the bed rail instead of the patient's body? Option A, scan the band on the bed rail and proceed with the draw. Option B, refuse to perform the venipuncture until a nurse verifies identity and attaches a new ID band directly onto the patient's body. Option C, ask the patient's visitor to confirm that the band belongs to the patient. Option D, cross out the name on the band and write it on a new tube label. The correct answer is option B, refuse to perform the venipuncture until a nurse verifies identity and attaches a new ID band directly onto the patient's body. An ID band attached to the bed rail does not reliably identify the patient. The phlebotomist should not collect until nursing staff verifies identity and attaches a proper band to the patient. Scanning or using a detached band creates a wrong patient risk. Question 49. What should a phlebotomist do if they observe a hematoma forming rapidly under the skin surface while performing a venipuncture? Option A, adjust the needle angle to try to drain the hematoma into the collection tube. Option B, terminate the draw immediately, release the tourniquet, withdraw the needle, and apply firm, direct pressure to the puncture site. Option C, instruct the patient to pump their fist forcefully to redistribute the blood. Option D, advance the needle deeper to pass completely through the hematoma layers. The correct answer is option B. Terminate the draw immediately, release the tourniquet, withdraw the needle, and apply firm, direct pressure to the puncture site. A rapidly forming hematoma means blood is escaping from the vessel into surrounding tissue. The draw should be stopped, the tourniquet released, the needle removed, and firm pressure applied. Continuing the attempt can enlarge the hematoma and increase pain or bruising. Question 50. If a patient experiences syncope during a venipuncture, what should the phlebotomist do first? Option A, call for an emergency code. Option B, complete the current tube collection. Option C, remove the tourniquet and needle immediately. Option D, place a cold compress on the patient's forehead. The correct answer is option C, remove the tourniquet and needle immediately. Syncope during venipuncture requires immediate protection from further injury. The tourniquet and needle should be removed first so bleeding and needle movement do not continue while the patient loses consciousness. Completing the tube collection is never the priority during a fainting episode. Question 51. A phlebotomist enters a room to draw blood from an inpatient but notices the patient does not have an identification band attached to their body. What is the proper course of action? Option A, draw the blood anyway and ask the patient to state their name. Option B, look for the ID band on the nightstand or 4-pole and scan it. Option C, refuse to draw the blood until a nurse attaches a new ID band to the patient. Option D, verify identity using the chart at the foot of the bed and complete the draw. The correct answer is option C, refuse to draw the blood until a nurse attaches a new ID band to the patient. An inpatient must have an identification band attached to the body before routine collection. A band on a table, bed rail, or 4-pole cannot prove the patient's identity. Nursing staff should replace or verify the band before the phlebotomist proceeds. Question 52. Why is the first drop of blood wiped away during a capillary puncture? Option A. It contains skin surface bacteria. Option B. It contains tissue fluid contamination. Option C. It hemolyzes too rapidly to be accurate. Option D. It clots too quickly to be collected. The correct answer is option B. It contains tissue fluid contamination. The first drop from a skin puncture often contains tissue fluid and surface contaminants from the puncture process. Wiping it away improves specimen quality and reduces dilution of the sample. Collecting that first drop can contribute to inaccurate chemistry or hematology results. Question 53. If a phlebotomist notices a hematoma beginning to form during a blood draw, what action should be taken immediately? Option A. Adjust the depth of the needle to stop the swelling. Option B. Remove the tourniquet, withdraw the needle, and apply firm pressure. Option C. Advance the needle further to bypass the hematoma. Option D. Request the patient to pump their fist to redistribute the blood. The correct answer is option B. Remove the tourniquet, withdraw the needle, and apply firm pressure. A developing hematoma means blood is leaking into surrounding tissue, so collection should stop at once. Releasing the tourniquet, withdrawing the needle, and applying firm pressure limits bleeding and tissue damage. Advancing the needle or continuing the draw can enlarge the hematoma and increase patient injury. Question 54. What type of vessel links the arterial system directly to the capillary network paths? Option A. Arteriole. Option B. Venule. Option C. Vena cava. Option D. Deep vein. The correct answer is option A. Arteriole. Arterioles connect arteries to capillary beds and regulate blood flow into tissues. Their muscular walls can constrict or dilate to control local perfusion. Venules drain capillaries, and lymph ducts carry lymph rather than arterial blood. Question 55. Which of the following is the most critical step in performing any phlebotomy procedure? Option A. Choosing the correct size needle. Option B. Verifying patient identification. Option C. Selecting the appropriate vein. Option D. Applying the tourniquet tightly. The correct answer is option B. Verifying patient identification. Patient identification must be verified before collection because every result is linked to treatment decisions for one specific person. A name alone is not enough when facility policy requires two identifiers such as full name, date of birth, or medical record number. Needle size, vein choice, and tourniquet technique matter only after the patient's identity has been confirmed. Question 56. What is the maximum acceptable delay time for separating serum or plasma from cells for most routine chemistry tests? Option A. 30 minutes. Option B. 2 hours. Option C. 4 hours. Option D. 8 hours. The correct answer is option B. 2 hours. For many routine chemistry tests, serum or plasma should be separated from cells within about 2 hours. Delayed separation allows cells to consume glucose and release or exchange analytes. Excessive delay can produce inaccurate results even if the collection itself was successful. Question 57. What type of consent is demonstrated when an adult outpatient rolls up their sleeve and extends their arm toward the phlebotomist after being asked for a blood draw? Option A. Expressed consent. Option B. Informed consent. Option C. Implied consent. Option D. Statutory consent. The correct answer is option C. Implied consent. Rolling up a sleeve and extending the arm after being asked to provide a specimen demonstrates implied consent. The patient's actions show cooperation with a routine procedure. Signed informed consent is a more formal process used when required by policy or procedure risk. Question 58. Which of the following tests requires a strict chain of custody tracking form to accompany the specimen through collection, processing, and analysis? Option A. Basic Metabolic Panel, BMP. Option B. Forensic drug analysis or paternity testing. Option C. Therapeutic drug monitoring for digoxin. Option D. Blood culture tracking for endocarditis. The correct answer is option B. Forensic drug analysis or paternity testing. Forensic drug analysis and paternity testing require strict chain of custody tracking from collection through analysis. This documentation preserves legal defensibility and proves specimen integrity. Routine clinical tests generally use standard identification and accessioning procedures. Question 59. Which of the following tubes contains no additives or gel barriers and is often used as a discard tube or for specialized serum testing? Option A, clear or plain red glass top. Option B, light blue top. Option C, lavender top. Option D, light green top. The correct answer is option A, clear or plain red glass top. Clear or plain red glass tubes contain no additive or gel and may be used as discard tubes or for selected serum testing. They are useful when additive carryover must be avoided. Colored additive tubes contain substances that can interfere with tests not designed for them. Question 60. Which of the following tubes contains the anticoagulant lithium heparin? Option A, light green top, PSD. Option B, dark blue top. Option C, yellow top. Option D, grey top. The correct answer is option A, light green top, PSD. Light green plasma separator tubes commonly contain lithium heparin and a gel barrier for chemistry testing. Heparin prevents clotting so plasma can be separated quickly after centrifugation. Other tube colors are used for trace metals, cultures, glucose preservation, or coagulation testing. Question 61. Which of the following conditions can cause a specimen to appear cloudy, milky, or white after centrifugation? Option A, extensive hemolysis from using a small gauge needle. Option B, lipemia caused by high concentrations of lipids or fats in the blood sample. Option C, icterus caused by elevated levels of circulating bilirubin molecules. Option D, failure to invert an additive tube immediately after collection. The correct answer is option B, lipemia caused by high concentrations of lipids or fats in the blood sample. Lipemia causes serum or plasma to appear cloudy, milky, or white because of high lipid concentration. It may result from non-fasting status or lipid metabolism disorders. Hemolysis and icterus cause red or yellow discoloration rather than milky turbidity. Question 62. Which of the following values represents a panic or critical laboratory value that must be reported immediately? Option A fasting glucose of 90 mg/dl. Option B, a potassium level of 2.1 mg/L. Option C, a total cholesterol level of 210 mg/dl. Option D, a white blood cell count of 7,500/mcl. The correct answer is option B, a potassium level of 2.1 mg/L. A potassium level of 2.1 mg/L is critically low and can cause dangerous cardiac rhythm disturbances. Critical values must be reported immediately according to facility policy. Normal glucose or white blood cell values do not require urgent panic notification. Question 63. Which of the following parameters can cause a false decrease in glycolysis tracking within a serum specimen? Option A, leaving the serum in contact with the red blood cells for longer than 2 hours. Option B, chilling the specimen on ice immediately after collection. Option C, protecting the specimen from exposure to room lights. Option D, mixing the tube gently 5 times right after the draw. The correct answer is option A, leaving the serum in contact with the red blood cells for longer than 2 hours. Glucose decreases when unseparated blood remains at room temperature because cells continue glycolysis. Serum left in contact with red cells for more than 2 hours can therefore show falsely low glucose. Prompt separation or use of a glycolysis inhibitor helps preserve the result. Question 64. Which of the following tests requires a fasting specimen to ensure diagnostic accuracy? Option A, complete blood count, CBC. Option B, lipid panel and fasting blood sugar. Option C, blood culture series. Option D, prothrombin time, patient. The correct answer is option B, lipid panel and fasting blood sugar. Lipid panels and fasting blood sugar tests are strongly affected by recent food intake. Fasting helps standardize triglyceride and glucose measurements for diagnostic interpretation. CBC, blood cultures, and patient usually do not require fasting for accuracy. Question 65. What type of collection is performed to screen for hidden blood in a stool specimen? Option A, occult blood test, GWAOC. Option B, culture and sensitivity, C&S. Option C, DOVA and parasites, O&P. Option D, fecal fat quantification. The correct answer is option A, occult blood test, GWAOC. An occult blood test, often using a GWAOC method, screens stool for hidden blood. It can help detect gastrointestinal bleeding that is not visible. Culture, ova and parasite testing, and fecal fat analysis evaluate different stool conditions. Question 66. Which of the following infections is considered the most common nosocomial risk for healthcare workers handling blood? Option A, human immunodeficiency virus, HIV. Option B, hepatitis B virus, HBV. Option C, tuberculosis, TB. Option D, malaria. The correct answer is option B, hepatitis B virus, HBV. Hepatitis B has historically been a major occupational concern for workers exposed to blood because it is efficiently transmitted by percutaneous injury. Vaccination reduces risk, but exposure prevention remains essential. HIV, tuberculosis, and malaria require appropriate precautions, yet they are not the most common blood-handling nosocomial risk in this context. Question 67. What should a phlebotomist do if they encounter an aggressive, uncooperative psychiatric patient accompanied by an order for blood work? Option A, enlist colleagues to restrain the patient by force without nursing guidance. Option B, postpone the draw and consult with the nurse in charge of the patient's care. Option C, attempt to draw blood while the patient is asleep. Option D, cancel the test order permanently on your own authority. The correct answer is option B, postpone the draw and consult with the nurse in charge of the patient's care. An aggressive or uncooperative psychiatric patient requires a safety-focused pause and coordination with nursing staff. The care team can determine whether the draw should be delayed, supported, or handled under a specific behavioral plan. Drawing while the patient sleeps or using force without guidance creates serious safety and legal risks. Question 68. What is the correct protocol for mixing an additive tube after filling? Option A, shake it vigorously up and down 5 times. Option B, roll it back and forth between your palms for 30 seconds. Option C, invert it gently back and forth the recommended number of times. Option D, let it sit completely still in a rack to mix naturally. The correct answer is option C, invert it gently back and forth the recommended number of times. Additive tubes must be mixed by gentle inversion the number of times recommended for that tube. This ensures blood contacts the additive without causing mechanical cell damage. Shaking, rolling, or leaving the tube unmixed can lead to hemolysis or clot formation. Question 69. Which of the following statements is true regarding standard precautions in healthcare settings? Option A, they apply only to patients with known, documented infectious diseases. Option B, they mandate that blood and all body fluids must be treated as potentially infectious regardless of the patient's perceived status. Option C, they require healthcare workers to wear a full gown and face shield for every routine venipuncture. Option D, they permit the recapping of used needles as long as you use 2 hands. The correct answer is option B. They mandate that blood and all body fluids must be treated as potentially infectious regardless of the patient's perceived status. Standard precautions require treating all blood and body fluids as potentially infectious. This approach protects healthcare workers and patients regardless of diagnosis or appearance. Selective precautions based on perceived risk misinfections that are unknown or asymptomatic. Question 70. When centrifuging specimens, what is the most important operational rule to follow? Option A, centrifuging serum tubes immediately before they clot. Option B, ensuring the centrifuge load is balanced by placing equal volume tubes opposite each other. Option C, leaving the lid open slightly to prevent overheating of the tubes. Option D, setting the speed to the maximum RPM regardless of tube type. The correct answer is option B, Ensuring the centrifuge load is balanced by placing equal volume tubes opposite each other. Centrifuge tubes must be balanced with similar volume tubes opposite each other. An unbalanced load can damage the centrifuge, break tubes, and create aerosol or biohazard exposure. Opening the lid during operation or using maximum speed without regard to specimen type is unsafe. Question 71. What type of patient environment requires protective, reverse, isolation protocols? Option A patient with an active, contagious respiratory flu virus. Option B, a patient with an open, draining MRSA wound infection. Option C, a patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Option D, a patient with suspected food poisoning or viral gastroenteritis. The correct answer is option C, a patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Protective or reverse isolation is used for patients with severely weakened immune systems. The goal is to protect the patient from microorganisms carried by staff, visitors, and the environment. Patients with contagious infections generally require standard, contact, droplet, or airborne precautions instead. Question 72. Which of the following tests evaluates the extrinsic coagulation pathway and is commonly monitored in patients taking oral warfarin therapy? Option A, activated partial thromboplastin time, APTT. Option B, prothrombin time / international normalized ratio, patient / INR. Option C, bleeding time determination. Option D, complete blood count, CBC. The correct answer is option B, prothrombin time / international normalized ratio, patient / INR. Patient and INR evaluate the extrinsic pathway and are commonly used to monitor oral warfarin therapy. Warfarin affects vitamin K-dependent clotting factors that influence this test. APTT is used more often for heparin therapy and the intrinsic pathway. Question 73. Which of the following variables can cause a specimen to appear cloudy or milky white after centrifugation? Option A, high levels of lipids, fats, circulating in the blood. Option B, extensive hemolysis from using a small needle. Option C, elevated levels of direct and indirect bilirubin. Option D, failure to mix an anticoagulant tube after drawing. The correct answer is option A, high levels of lipids, fats, circulating in the blood. High circulating lipid content produces a cloudy or milky serum or plasma appearance after centrifugation. This condition is called lipemia and may interfere with optical laboratory methods. Hemolysis creates red discoloration, while icterus creates yellow discoloration. Question 74. Which of the following parameters is evaluated when checking a patient's prothrombin time? Patient. Option A, the functional capacity of platelets to adhere to vessel linings. Option B, the extrinsic pathway of the coagulation cascade and warfarin's therapeutic impact. Option C, the total count of circulating red blood cells per microliter. Option D, the efficiency of the kidney to filter out waste urea molecules. The correct answer is option B, the extrinsic pathway of the coagulation cascade and warfarin's therapeutic impact. Patient evaluates the extrinsic and common coagulation pathways and is commonly reported with INR. It is especially useful for monitoring warfarin therapy. Platelet function, red cell counts, and kidney filtration are assessed with different tests. Question 75. Which of the following is the correct order of draw for a dermal, capillary, puncture? Option A, lavender, green, red. Option B, red, green, lavender. Option C, green, lavender, red. Option D, light blue, lavender, green. The correct answer is option A, lavender, green, red. Capillary collections prioritize EDTA specimens first because small skin puncture samples clot rapidly. Other additive tubes follow, and serum tubes are typically collected last because clotting is expected there. Using Venipuncture order for capillary specimens can allow microclots to compromise hematology testing. Question 76. Which of the following tubes contains a clot activator paired with a thixotropic gel barrier designed for serum separation? Option A, light green top, PSD. Option B, gold or red /black marbled top, SST. Option C, lavender top, EDTA. Option D, light blue top, sodium citrate. The correct answer is option B, gold or red /black marbled top, SST. Gold or red black marbled SST tubes contain a clot activator and thixotropic gel for serum separation. The clot activator speeds clot formation, and the gel forms a barrier after centrifugation. PSD tubes produce plasma because they contain heparin instead of a serum clotting system. Question 77. Which of the following standard precautions applies to the disposal of used venipuncture needles? Option of recapping the needle before throwing it away. Option B, placing the needle in a biohazard bag. Option C, activating the safety device and placing it in a sharps container. Option D, dropping the needle into a regular waste bin if no blood is visible. The correct answer is option C, activating the safety device and placing it in a sharps container. Used needles must be made safe immediately and placed into an approved sharps container at the point of use. Recapping, carrying loose needles, or placing them in bags creates preventable needle stick risk. Visible blood is not required for an item to be treated as contaminated after use. Question 78. Why is it essential to allow the 70% isopropyl alcohol to dry completely on the skin before puncturing? Option A, to prevent the alcohol from evaporating too fast. Option B, to avoid hemolysis of the specimen and a stinging sensation for the patient. Option C, to ensure the vein does not roll during insertion. Option D, to maximize the chemical interaction with the tube additive. The correct answer is option B, to avoid hemolysis of the specimen and a stinging sensation for the patient. Alcohol must dry completely so it can disinfect effectively and avoid being carried into the puncture site. Wet alcohol can sting and may contribute to hemolysis or specimen contamination. Blowing on or fanning the site can recontaminate the area and should be avoided. Question 79. Why is a royal blue top tube used for trace element and toxicology testing? Option A, the tube contains a unique fast-acting liquid anticoagulant. Option B, the tube stoppers are specially manufactured to be free of trace element contamination. Option C, the tube is thicker to resist breaking in specialized centrifuges. Option D, the tube completely blocks out all infrared and UV rays. The correct answer is option B, the tube stoppers are specially manufactured to be free of trace element contamination. Royal blue tubes are manufactured to minimize trace element contamination from stoppers, glass, plastic, and additives. This is essential for toxicology and trace metal testing where very small contamination can alter results. The color does not mainly indicate light protection or faster anticoagulation. Question 80. Which of the following situations can lead to a charge of negligence against a phlebotomist? Option A, forgetting to sign your initials on a laboratory requisition sheet. Option B, leaving a tourniquet tied on a patient's arm for 5 minutes, resulting in permanent nerve injury. Option C, experiencing a minor specimen rejection due to an underfilled tube. Option D, utilizing a butterfly needle on an elderly patient's hand vein. The correct answer is option B, leaving a tourniquet tied on a patient's arm for 5 minutes, resulting in permanent nerve injury. Negligence occurs when a healthcare worker fails to meet the expected standard of care and the patient is harmed. Leaving a tourniquet on for 5 minutes can cause avoidable injury and inaccurate results. A poor outcome alone is not negligence unless duty, breach, harm, and causation are present. Question 81. Which of the following actions represents the correct method for mixing an additive collection tube after drawing? Option A, shaking the tube vigorously up and down 10 times. Option B, inverting the tube gently back and forth the recommended number of times, typically 3 to 10 depending on tube type, to ensure adequate mixing without causing hemolysis. Option C, letting the tube sit completely undisturbed in a vertical rack to mix over time. Option D, rolling the tube vigorously between your palms for 2 minutes. The correct answer is option B, inverting the tube gently back and forth the recommended number of times, typically 3 to 10 depending on tube type, to ensure adequate mixing without causing hemolysis. Additive tubes must be mixed by gentle inversion for the number of times recommended for that tube type. This distributes the additive evenly without causing hemolysis. Vigorous shaking or inadequate mixing can create clots, cell damage, or inaccurate results. Question 82. What is the standard ratio of blood to anticoagulant additive in a green top tube? Option A 9:1, Option B 4:1, Option C. There is no strict ratio as long as the tube contains enough anticoagulant to prevent clotting. Option D 1:1. The correct answer is option C. There is no strict ratio as long as the tube contains enough anticoagulant to prevent clotting. Green top heparin tubes do not depend on a strict blood to additive ratio like light blue citrate tubes. The tube should still be filled adequately and mixed gently so enough heparin is present to prevent clotting. Coagulation citrate specimens are the classic ratio-sensitive collection. Question 83. Which of the following additives works by chelating or binding calcium to inhibit the coagulation cascade? Option A lithium heparin. Option B ethylenediamine tetracetic acid, EDTA. Option C sodium fluoride. Option D ammonium oxalate. The correct answer is option B, ethylenediamine tetracetic acid, EDTA. EDTA chelates calcium, removing a key requirement for activation of the coagulation cascade. This prevents clot formation and preserves whole blood for hematology and selected molecular tests. Heparin prevents clotting through antithrombin rather than calcium chelation. Question 84. Which of the following tests is part of a routine liver function panel? Option A, creatinine. Option B, alanine aminotransferase, ALT. Option C, hemoglobin A1c. Option D, troponin I. The correct answer is option B, alanine aminotransferase, ALT. ALT is a liver-associated enzyme included in routine liver function evaluation. It helps assess hepatocellular injury when interpreted with other liver markers. Creatinine, HbA1c, and troponin are associated with kidney function, glucose control, and cardiac injury rather than a standard liver panel. Question 85. What is the function of sodium polyent whole sulfonate, SPS, inside a yellow top blood culture tube? Option A, to inhibit the growth of bacteria. Option B, to preserve glucose levels for bacterial metabolism. Option C, to aid in bacterial recovery by inhibiting complement and phagocytosis. Option D, to lyse red blood cells to release intracellular pathogens. The correct answer is option C, to aid in bacterial recovery by inhibiting complement and phagocytosis. SPS helps blood culture recovery by inhibiting complement, phagocytosis, and some antimicrobial activity in the specimen. This supports survival of microorganisms until incubation and analysis. It is not intended to kill bacteria or preserve glucose for chemistry testing. Question 86. A patient under contact precautions requires a blood draw. Which of the following personal protective equipment, PPE, must the phlebotomist don before entering the room? Option A, N95 respirator and gloves. Option B, gown and gloves. Option C, surgical mask and face shield. Option D, gown, mask, and goggles. The correct answer is option B, gown and gloves. Contact precautions require barrier protection against organisms spread by direct touch or contaminated surfaces. Gown and gloves protect clothing and hands before entering the room and should be removed according to facility procedure before exit. Respirators are reserved for airborne hazards, while masks and eye protection are added when splash or droplet exposure is expected. Question 87. A patient refuses to have their blood drawn. What is the most appropriate next step for the phlebotomist? Option A, convince the patient by explaining the doctor's orders. Option B, proceed with the draw while the nurse holds the patient's arm. Option C, document the refusal and immediately notify the nursing staff or provider. Option D, leave the room and mark the collection as completed. The correct answer is option C, document the refusal and immediately notify the nursing staff or provider. A competent patient has the right to refuse venipuncture, even when a provider ordered the test. The phlebotomist should document the refusal and notify nursing staff or the ordering provider so follow-up decisions can be made. Attempting to persuade aggressively or drawing against the patient's wishes can create legal and ethical problems. Question 88. What is the clinical term for a decrease in the total number of circulating red blood cells or a decrease in hemoglobin concentration? Option A: polycythemia. Option B: anemia. Option C: leukemia. Option D: leukopenia. The correct answer is option B, anemia. Anemia means a decrease in circulating red blood cells, hemoglobin concentration, or oxygen carrying capacity. It can cause fatigue, pallor, shortness of breath, or dizziness depending on severity. Polycythemia is increased red cell mass, while leukopenia involves white cells. Question 89. What is the main reason for avoiding blind probing or sweeping when attempting to locate a vein? Option A: it breaks the vacuum seal of the multisample tube. Option B: it can cause permanent damage to underlying nerves and blood vessels. Option C: it dulls the needle tip and makes skin entry painful. Option D: it causes the patient's blood pressure to spike excessively. The correct answer is option B. It can cause permanent damage to underlying nerves and blood vessels. Blind probing or sweeping moves the needle through tissue without knowing where the tip is. This can damage nerves, arteries, tendons, and surrounding soft tissue. If blood flow is not obtained with minor adjustment, the attempt should be stopped and reassessed. Question 90. What should a phlebotomist do immediately after activating the safety device on a used venipuncture needle? Option A: place the needle assembly into a rigid, leak-proof sharps container located near the point of use. Option B: drop the needle into a biohazard waste bag with blood-stained gauze. Option C: set the needle down on the patient's bedside table until the tubes are fully labeled. Option D: detach the needle from the tube holder adapter and place only the needle into the sharps container. The correct answer is option A. Place the needle assembly into a rigid, leak-proof sharps container located near the point of use. After the safety device is activated, the used needle assembly should go directly into a rigid, leak-proof sharps container near the point of use. Immediate disposal minimizes handling and needle stick risk. Needles should not be recapped, carried around, or placed in regular trash. Question 91. Which of the following tubes is typically selected for a zinc, copper, or trace element determination? Option A: royal blue top tube. Option B: lavender top tube. Option C: light blue top tube. Option D: grey top tube. The correct answer is option A: royal blue top tube. Royal blue top tubes are designed for trace element testing such as zinc and copper. They minimize contamination from tube components that could falsely elevate trace metal results. Routine additive tubes are not manufactured to the same low contamination standards. Question 92. What is the correct angle of insertion for a standard multisample needle during a venipuncture? Option A: 5 to 10 degrees. Option B: 15 to 30 degrees. Option C: 45 to 60 degrees. Option D: 90 degrees. The correct answer is option B: 15 to 30 degrees. A standard straight needle is usually inserted at a shallow 15 to 30 degree angle to enter the vein smoothly. This angle helps avoid passing through the vein or striking deeper structures. Very shallow angles can miss the lumen, while steep angles increase tissue trauma. Question 93. What type of transmission is prevented by wearing an N95 respirator when working with a patient who has active tuberculosis? Option A: droplet transmission. Option B: contact transmission. Option C: airborne transmission. Option D: vector-borne transmission. The correct answer is option C: airborne transmission. Active tuberculosis is spread by airborne droplet nuclei that can remain suspended in the air. An N95 respirator helps filter inhaled particles when entering an airborne isolation setting. Surgical masks are used for droplet precautions, and gowns or gloves address contact risks rather than airborne inhalation. Question 94. What is the most appropriate step to ensure compliance with quality control measures regarding point-of-care testing, POCT, instruments? Option A, calibrating the machine once every year. Option B, running control solutions at scheduled intervals according to facility protocol. Option C, cleaning the display screen with water after every patient test. Option D, trusting the automated self-check system without external verification. The correct answer is option B, running control solutions at scheduled intervals according to facility protocol. Point-of-care testing requires routine quality control to confirm the instrument and reagents are performing properly. Running controls according to manufacturer and facility schedules helps detect problems before patient results are reported. Relying only on automated self-checks or annual calibration is not sufficient. Question 95. What is the target population for a GU3 card or newborn screening test panel? Option A, geriatric outpatients in nursing homes. Option B, infants up to a few days or weeks old. Option C, pregnant women in their first trimester. Option D, patients undergoing active chemotherapy treatments. The correct answer is option B, infants up to a few days or weeks old. GU3 cards and newborn screening panels are designed for infants shortly after birth. They screen for metabolic, endocrine, and genetic conditions that benefit from early detection. Adult, prenatal, or oncology testing uses different screening methods. Question 96. Which of the following tests requires a plain red top tube with no gel or additives? Option A, complete blood count, CBC. Option B, type and screen. Option C, certain therapeutic drug levels that bind to gel barriers. Option D, plasma glucose tracking. The correct answer is option C, certain therapeutic drug levels that bind to gel barriers. Some therapeutic drugs can bind to separated gel or be affected by tube additives. A plain red top tube without gel is used when the test requires serum free from gel interference. CBC, blood bank testing, and plasma glucose monitoring use different specimen types. Question 97. What type of specimen is required for a plasma hemoglobin test? Option A, serum separator tube, SST. Option B, plain red top tube. Option C, heparinized or EDTA plasma free of hemolysis. Option D, whole blood collected in a gray top tube. The correct answer is option C, heparinized or EDTA plasma free of hemolysis. Plasma hemoglobin testing requires plasma that is not contaminated by hemolysis from collection trauma. Heparinized or EDTA plasma is used because anticoagulated blood can be centrifuged to separate plasma. Serum or visibly hemolyzed specimens can falsely affect the measurement. Question 98. A phlebotomist needs to collect a specimen for a complete blood count, CBC. Which color tube should be selected? Option A, red. Option B, green. Option C, light blue. Option D, lavender. The correct answer is option D, lavender. CBC testing requires anticoagulated whole blood with preserved cellular morphology and accurate cell counts. Lavender tubes contain EDTA, which binds calcium and prevents clotting while maintaining blood cell detail. Serum, citrate, or heparin tubes can alter hematology results or create unsuitable specimens. Question 99. A serum separator tube, SST, contains an additive that assists in what process? Option A, preventing coagulation. Option B, accelerating coagulation. Option C, inhibiting glycolysis. Option D, preserving blood cultures. The correct answer is option B, accelerating coagulation. Serum separator tubes contain a clot activator that speeds the formation of a clot before centrifugation. After clotting, the gel barrier separates serum from blood cells during spinning. Anticoagulants prevent clotting, so they would not produce serum in the same way. Question 100. What is the maximum amount of time a tourniquet should remain tied on a patient's arm during a venipuncture? Option A, 30 seconds. Option B, 1 minute. Option C, 2 minutes. Option D, 3 minutes. The correct answer is option B, 1 minute. Tourniquet time should generally be limited to 1 minute to prevent venous stasis and hemoconcentration. Longer application can concentrate proteins, cells, potassium, calcium, and other analytes. Releasing and reapplying after a pause is safer than leaving it tied while searching for a vein.